Well, in vitro fertilization is one of the processes that people kind of sometimes see as big and scary. And it's really not. We try to break it down. We try to walk people through the process because it is our most successful type of treatment. However, it involves a lot of steps. And those steps are what differentiates us, what we feel from other in vitro fertilization centers. In vitro fertilization, or IVF as it's commonly talked about, is a procedure that is used to help couples mainly with tubal factor infertility or male factor infertility, if the gentleman has a low sperm count or he has sperm that are not functional. Other than that, it can be used for a lot of other indications, such as pelvic factor, endometriosis, problems with pelvic adhesions, things like that. So there's a multitude of options, and then 15% of the patients that do in vitro fertilization do it because of unexplained infertility. Well, a lot of the centers, okay, and essentially when you're looking at a lot of these large IVF centers, okay, that is basically the mainstay of the practice is IVF. So the whole goal is get people through, do the IVFs, okay. That's important. There's lots of other treatments other than in vitro fertilization, but that's one of the things that we give our patients options for. We let them know what kind of other treatments that are available, what the success rates of those other treatments are, and in some cases, IVF is not your only option. It's certainly your most successful option. Okay? Some people don't want to try in vitro for lots of different issues. Some people think it's too expensive. Some people are afraid of the risk of multiple births. Some people are afraid they're not going to have a healthy baby. None of that is true. Well, the first couples that should get IVF are patients with tubal factor infertility and male factor infertility, because that is the best treatment options for them. Then there's other couples that have failed lesser aggressive types of treatment that have come to a point where they're still not conceiving, and then at that point we usually recommend in vitro fertilization. Other than that, we finance the cycles. We have very reasonable financing options through lots of different programs to try to help patients through the process, because that is one of the main things that patients don't go through treatment because they're afraid that financially they won't be able to afford it. And we've tried to make that a lot easier on them. And then again, putting our investment into it as well with these money-back guarantee programs has certainly helped patients feel more comfortable proceeding with treatment. We've helped thousands of couples have babies over the years. It's a wonderful process. I mean, it's the most exciting thing that we do here.
Call the South Florida Institute for Reproductive Medicine today, 866-483-6366.